What's being done here at the University of Louisville is nothing new, but previously it was Campus Health making those phone calls. But as the university made the move to resume in-person classes, it was decided a team should be dedicated full-time to contact tracing.
Hi, this is Mamie with the contact tracing.
The days are long and the phone calls, at times, seemingly endless.
Since it's been more than 10 days, I just wanted to follow up and see how you're doing.
But for Sivarchna Maridu, who is leading the contact tracing team at U of L, the work to defeat COVID-19 is not only important, but personal.
In India, I had a couple of family members who were pretty healthy, and then 2 days later, 3 days later, they were sick and intubated, and they didn't make it.
In August, Maridu and a team of 10 specially trained public health students became the university's contact tracing specialists. In an effort to control and slow the spread of the virus, those in the campus community that have tested positive are contacted by a specialist.
Okay, what symptoms did you have?
And ask detailed questions about who they may have come into contact with.
Are you living on campus?
That information and the identity of the person who tested positive remains confidential, is then shared with others who are advised to quarantine. Grad student Eric Lumsey averages about 30 hours a week, but sometimes stays longer, and he does so gladly.
You just don't want to risk, seeing a cluster pop up because you didn't, leave a voicemail, or you decided that, I want to leave here on time, so I'm not going to make that phone call.
So far, hundreds of calls have been made, and Maridu says it's all about people, the ones her team is working to keep safe in the midst of a global pandemic.
It's just not a number to me, and I don't want anyone to lose family because of this.
Lauren Adams, WLKY News.
Thank you, Lauren. And right now, there are 11 people on the team working as contact tracing specialists, but there are plans to expand.